I'm Scott Vold. I'm CEO and co-founder of Fibroblast. And what Fibroblast is really a company on a mission to ensure that no patient slips through a crack in the healthcare system. And what we really do is ensure that a patient gets from point A to point B and gets the life-saving care they need. The core of our company is really a patient matching algorithm. The idea is to take a unique patient, what we know about the patient's demographic information, insurance information, and their clinical information, right? The DX codes and reasons why they're at the doctor. And then look at the other providers in the network and ensure that the right patient is matched with the best, highest quality, lowest cost, most valuable provider for that patient. And really, it's data intensive work, and it requires our partnership with Redox. We looked at the market and we tried to understand the players in the market and understand their level of experience and sophistication. And the primary things that drew us to Redox were the following. Number one, the company had deep understanding of integrations. That's all they did, right? It was the core competency of the company. And at the time, it seemed as though everyone at the company had either worked at Epic or some other EMR company, and that gave us enormous comfort that they'd be able to help us accomplish what we needed to do. And secondly, I'm not technical. A lot of the folks in our client success team are not technical, and yet the folks at Redox took what we perceived to be enormously complex problems and integration points and really communicate them to us and our client in a simple, easy, digestible way that accelerated our integration and made really the whole process simple and easy. I would say that the experience with Redox has been like any other experience we've had with an integration partner or an integration vendor, in that they really took the best of what you'd get in a consumer application, right? The ease of integrating with an API, the customer support that you'd expect from any other company outside of healthcare, and they brought that to healthcare. So it seems as though they put a lot of design thinking and customer success into their process. In other words, it was completely different than you'd expect an experience to be integrating with someone else. They made it simple. Documentation was easy. They were there to help our team at every step along the way. They were highly communicative, and they provided just sort of ease of access. We are a company at an inflection point. Looking at 2018, we have a huge sales pipeline ahead of us. We have a lot of contracts that have been closed and a long implementation cycle. We deal with health systems all across the country, coast to coast, that have multiple different EMRs, from Epic to Cerner to Allscripts and Athena and others. And what Redox allows us to do is service all of those clients at scale, right, to help connect all of these disparate dots or data silos, to go fast and to deliver an integration solution very cheaply and very cost effectively to our clients.